We are going to be learning about bioavailability and routes of administration. Basically, bioavailability is the fraction of the drug that reach the systemic circulation or that reach the bloodstream in its unchanged form. And we are looking at the bioavailability question, also discussing about the routes of administration. Yeah, it says a man was administered to the hospital for chest pain and deep vein thrombosis. He was given nitroglycerin. He was given nitroglycerin and an anticoagulant to relieve symptoms. Discuss the effective route of administration. So we knew he was given nitroglycerin, was given anticoagulants. So nitroglycerin for his chest pain, anticoagulant for the deep vein thrombosis. If we want to discuss the route of administration, we know that there are two major routes of administration. We have the systemic route that is inside the body system, and we have the local route that is outside the body system. Inside the systemic route of administration, we have entera, right? That is inside the enteron. Enteron means small intestine. Entera and parenteral. Parenteral. That is into the bloodstream or outside the GIT. And for local, we have, at the skin surface, which are the topical and so on and so forth. For the entire route of administration, we have oral, oral, we have sublingual, and we have rectal. For the parenteral route of administration, we have intravenous, intramuscular, inhalational, um, subcutaneous, you know, different routes into the bloodstream, into the muscle, into the spinal cord, the epidural space of the spinal cord, into the subcutaneous tissue of, um, into the artery, IA, interarterial. And for local, which is outside the systemic circulation, we have topical, we have mucosal administration, and so on and so forth. At the end of this video, you can watch the full teaching on routes of administration. Now, if you're looking at this particular study, you said the man was administered to the hospital for chest pain. And if you remember from your pharmacology, chest pain, also called angina, chest pain is also called angina. It is when let's say this is the heart. So let's do a little bit of anatomy of physiology. This is the heart and this is the blood supply to the heart, right? So if there's a blockage, or let's say an ischemic occurrences where there is decreased flow of blood supply to the heart, it will lead to chest pain, or you can also call it angina. If you remember from your CVS pharmacology, I'm going to have a lecture on that. So we give nitroglycerin to relax the smooth muscle, of the arterial walls of the blood vessel, enabling more blood flow to the heart. So this particular drug now would need it directly to the bloodstream because it's acting on the blood vessel, right? It's acting on the blood vessel. If we are going to give this nitroglycerin orally, remember we are discussing the effective route of administration. If you are going to give it orally, it will pass through the liver and it might be metabolized before reaching the bloodstream. That is called first pass effects, right? So we want to give this drug either intravenously, though there are some drugs that are some there are some nitropuricide that are used to relieve chest pain that comes in oral tablet, but for effective and fast bioavailability of the drug, the fraction of the drug that is inside of the bloodstream, would need to give this drug through the sublingual routes. It's mostly given sublingually, that is under the tongue. Let's say this is our tongue. You put your drugs here under the tongue, Now we know that if you check at the base of your tongue, it is highly supplied by blood vessels, right? That means it is highly vascularized. And putting nitroglycerin or giving nitroglycerin through the sublingual route of administration enables a bioavailability of at least 95 to 100 directly into the bloodstream to cause its vasodilating action. So we give nitroglycerin. The effective route is given sublingually to bypass the first pass effect. And anticoagulants, they are drugs that breaks down or inhibit coagulation. They are drugs that dissolve blood clots, right? I will say this man is was administered to the hospital for chest pain, angina. We have spoken about the effective route of administration of nitroglycerin, which is given sublingually because the nitroglycerin will diffuse into the soft mucosal tissue of the tongue, entering into the bloodstream. Talking about anticoagulants like general class of anticoagulants like antiplatelet drugs, fibrolytics, um, anticoagulating drugs. You can mention all of them. This question is not really specified for a particular kind of disease, but for DVT, we can use warfarin, we can use aspirin as an antiplatelet factor. We can also use fibrinolytics to dissolve or break down fibrin clots. Now, when you give this drug orally, of course, you don't want to give it orally because you want these particular drugs to act on the bloodstream. Deep vein thrombosis. Thrombosis is when there's a thrombus that is occluding a thrombus that is occluding blood flow in the vein. So you want to give an anticoagulant intravenously. You want to give it by any of the injectables, IV. That is the most effective route, intravenously, for it to have the highest bioavailability possible and for it to work, for you to get the full therapeutic value of the drug. So the effective route of administration for chest pain is nitroglycerin given sublingually under the tongue to diffuse into the bloodstream and reduce chest pain, relieving symptoms. And anticoagulants, any of the anticoagulants that you want to use for DVT, deep vein thrombosis, given intravenously. Though we have oral tablets, but we're looking at the most effective route of administration that can cause, a therapeutic pharmacological action in real time. So this question, anticoagulants given intravenously, nitroglycerin given sublingually. You can also um, watch videos on first class effect, watch videos on um, route of administration to learn more concerning bioavailability, first class effect, and route of administration.